Thank you for joining us on this episode of Let's Talk Teeth Live. I am so excited to have Dr. Shira Levy here with us today. Today we're talking about sleep apnea. Sleep apnea has become so near and dear to my heart and also to Dr. Levy after we've learned over the courses the effects that it has on your daily life. So if you guys have ever heard of someone that stopped breathing at night and died in their sleep, and it was just a cause of, oh, they just died in that sleep, it could have been sleep apnea. That's why it's so important that we're here today, and I'm so excited that we're talking about it. Thank you, Dr. Levy, for joining us. As I said, we took a course on sleep apnea, and then after that course, it just changed our whole outlook on it, and we just kind of just dove into it. So, yeah, Dr. Levy?
The trajectory.
Yeah.
Hi, so we went to a class. It was kind of a basic introductory class. We went with another team member with not high expectations.
Right.
We didn't know. We were almost becoming the cliche dental office and doing obstructive apnea because everyone is doing it. But when you start to learn what it actually is and what it means and how much it affects people's health and how many people it affects, how many people have no idea that it's even there, what to look for, it's staggering. And as they were going and reviewing symptoms and what to look for, who potentially has it, we were all kind of making mental checklists of either patients of ours that fit the bill and our own family members. Yes. And for me, it was my boy who was 2.5 at the time, and it was just it just hits you where you're like, oh my God, I wouldn't even know that this little boy is sick and what kind of life and trajectory does he have.
So sleep apnea does not affect a certain age or for a certain race?
It does not, and that was one of the most shocking things I think we found out, and maybe we were just overly ignorant, maybe. But I didn't know that it's something that you can have as a child, and the symptoms would be something basic: kids snoring, kids grinding their teeth. These are things that are not normal. They should have the best sleep of their lives at that time, and that's something that should be a red flag to parents. And then as you get older, you think of it as something that older men have, heavy set people,
right?
And the bottom line is you can be very thin, very young. It's a positional obstruction. It's not necessary. Weight exacerbates it, but there is no one particular patient. Anybody can have it. And that was one of the things that I think was.
So you said weight exacerbates it. What else?
So weight will make a physical obstruction worse because if you're gaining weight around your neck, if you're gaining weight around your stomach, those are going to contribute to sleep apnea. But it's more the other way around, where sleep apnea exacerbates everything else. So if you have diabetes, you have hypertension, you have heart conditions, you have a disease like Alzheimer's or something. Pregnancy, anything can be made worse by an underlying undiagnosed apnea. Because if you stop breathing, then everything has to work harder. Your body cannot heal, and you're unhealthy, and you may not know why. And in children, they can't concentrate. They're tired. It's hard for them to learn. It's hard for them to function, and they don't know why. This is all they've known their whole lives. And if they're diagnosed, they have ADD, they're on medication, when really they just need to breathe and they need a good night's sleep. And in children, it's a particular kind of therapy where dentists can be so instrumental in just identifying early signs. In adults, it's another kind of therapy, from appliances, CPAPs, orthodontics, surgery. There are options for patients. And as dentists, we are in the unique position to look at people's airways, recognize anomalies in behavior. Grinding and clenching is not a normal thing. We see it every day, so we just kind of brush it off, but it shouldn't be there. Headaches, snoring, these are all, and not to, on our medical checklist as well. No.
So does everyone that snore have sleep apnea?
No, not necessarily. But snoring is essentially an obstruction in air flow. So the degree to which you snore can contribute, may or may not be, but you have to get tested and get a diagnosis. So we have no way of knowing, but snoring is an indication that there's something is not right.
If you all out there have any questions about sleep apnea or see any of these signs in your home with your loved ones or your children of snoring or just restless or waking up tired, definitely drop us a line if you would like a consult. I'm all about the freebies. So Dr. Levy has agreed to do free sleep apnea consults. And if you are watching this live and you would like to come in, we are located here in Hyde Park in Chicago, Illinois at University Dental Professionals. The number is 773-684-5702. Like in the comments, drop us a line, your email, and someone will set you up for a free consult. This is how serious and near and dear sleep apnea needs to get out there in our community. So Dr. Levy, again, how does it affect your daily life?
So so there's the obvious one where you're just going through life and you're tired. So if it's that person who sits down and immediately falls asleep, or that's the basic of it. But the deeper effects are, because you probably have this a lot longer than people assume that you have diseases. It shaves years off your life mostly because of oxygen that isn't going to the tissues. Everything has to work a little bit harder. And again, if you have, at the same time that you have diabetes, you have hypertension, you have other issues, you're just sicker. So those are the big ramifications. Headaches, joint issue, any sort of pain can become chronic pain. It's debilitating. So there's different levels and there's different severities, and so that's why people have to come. They have to get diagnosed. We send people home with a sleep test.
Yes, what is the sleep test?
So a home sleep test is a way for people to get diagnosed if they don't choose to go to a sleep lab. This is just something we can give them in the office. They go home with it, they sleep with it for a couple of nights, and we get quite a few metrics and measurements. Everything is read by a board-certified sleep physician, and we get a proper diagnosis. Once we have a diagnosis, we're able to discuss treatment options with patients. And like I said, there are many options and different things that we can try to find what fits each individual patient so that they're comfortable and breathing and sleeping at night and getting what they need and improving their quality of lives, how long they live, how long they can be with their families. And with children, just keeping kids healthy. It's just imagine being exhausted all the time, and it's a form of torture. So it's horrible. And little kids, they can't tell you.
So then they come into your office and you explain this real simple. They take this home. It's pretty simple to use.
Mm-hmm.
This just goes in the nose. It's got a little chip in it, and it goes on the top of your head, and you just sleep with it for 2 nights. And this little trip reads it. You bring it back. You connect it to the computer, and it reads off of how well you're sleeping.
You get raw data instantly. So
what kind of data does it give?
So it tells you your heart rate, your oxygen blood level, the position of your sleep, the type of sleep that you're in, deep sleep, light sleep, REM sleep. You get heart rate, I don't know if I said that. I think those are the big ones that you get with that. And all those and obviously the nasal cannula checks breathing, and then everything combined gives us the metrics that the physician needs to make a diagnosis. Do you have apnea? What kind of severity? There's different levels of it, and then along with other metrics that we use to identify, throat, we'll take cone beam scans, we'll take other measurements to see what would be the best approach for this patient. And that's what we do.
So it has different severity levels. So the severe severity level, CPAP, something like this, what you sleep with, would be the standard of care. But for mild and moderate, we may be able to make you an a device.
Orthostatic or appliance. At the same time, if you are severe and you cannot tolerate this, unorthotic might still be appropriate because something is better than nothing. So anything that helps you maintain your airway at night is better than it collapsing.
Breathe.
I just want you to breathe. I don't care what modality you use. Our appliance can work very well. CPAP works very well. We just want people to get tested and get treated. And again, it's going to be different. It's going to be different for different patients. It's all tailored to what they have and their needs, their lifestyles. If they travel, they're not going to want to travel with a big bulky, so maybe combine their anyway. I could go on, but it's whatever is right for that patient, whatever they want to do.
And I'm sure a lot of my viewers want to know how this is paid for. So we do medical billing here, and it is considered a medical device. So we do aid in helping with the co-pays and the deductibles by not only billing for your dental but also your medical. And we got into medical billing specifically for this because this is something that's very serious that's affecting our community, and our community is not so aware about, and we need to help them and aid them in living a better life. Thank you so much, Dr. Levy, for joining us.
I will talk about this all day, and anybody who cares to listen.
Yes.
This is like you said, it's very, very important. And people need to know about it and not just think that, oh, look how cute, he's sleeping again, he fell asleep. No, it's not cute.
Well, one question I've been hesitant to asking. So what would you say to that newlywed couple who partner has sleep apnea, and it's not so sexy to sleep with this at night? It kind of gets in the way,
A little bit, but I would think that if someone loves you enough to marry you, they want you to stick around for a bit, and so they want you to breathe at night, and so you should always breathe.
Well, there
That's
you
my
go.
message for the day.
Well, there you go. If you or someone you love may be experiencing sleep apnea, a free consult or signs of it, a free consult. Why wouldn't you? Why wouldn't you share this? Why wouldn't you like this? Why wouldn't you come in and get evaluated for a free consult and let us help you in living a better life? Thank you guys so much for joining Let's Talk Teeth Live. We're here at University Dental Professionals. We're located at 5549 South Cornell Avenue. Our office number is 773-684-5702. Thank you so much and have a great day.
So we do have one question from a viewer.
Oh, we do? Okay, what's the
Yes.
question? Amber's behind the scenes. You can't see her. Say hi, Amber.
That's how I feel, Amber.
So the viewer wants to know, how do you know if you suffer from sleep apnea? This is Kimberly.
Kimberly, the only way to know for sure is to get tested for it. You can say, well, do I snort? Do I grind my teeth? Do I get headaches? Do I wake up? Do I ever gasp? Has anyone ever had to tap me while I'm sleeping? Those are kind of the obvious ones, but the bottom line is you have to get a diagnosis. That's really the only way for us to know.
So Kim, come in, drop us a line, like the video, and come in and get tested. I mean, it could save your life. Seriously. Do we have another question, Amber?
Yes, we have one more question. Where is the best place to get one of the sleeping devices? This is from Summer.
Okay. Well, actually, Dr. Levy, so you come in and see Dr. Levy, and Dr. Levy, actually, she does, and this is another, question. Okay, answer your question. Dr. Levy, you come in, you see Dr. Levy, she makes the device for you, and
The lab
makes the device.
They are custom made.
There you go.
They are custom made. So when she says sleep device, I'm assuming you mean the oral sleep device. That is custom made for each person because everybody is different. This is not something that you buy over the counter. And if you mean sleep device, if you mean CPAP, that's also individually fitted to you. Don't quite know that route, but it's all individually done. So you have to come into an office to get that taken care of.
So my question, Dr. Levy,
Yes.
I'm so glad I did not forget this question.
Yes.
Now I went, like you, we've been to several sleeps, we've been studying this for a while now. And I went and I heard someone speak on sleep, and one of the members in the audience was like, I had a sleep device made, but it messed up my alignment, or it made me, having issues here.
Mm-hmm.
And the answer that was given was not a great answer. How do you answer it? I know you do measurements and tests to make sure that, tell us about it.
So the bottom line is, the downsides of an appliance and the risks that are involved is you could get some joint complications, or your bite can shift a little bit. So we try to minimize any sort of complication. The joint, especially, I'm very mindful of the joint and the appliances that are made. It's why everything is done individually to minimize everything. Your bite could potentially shift, and that's okay because you're breathing. That's the bottom line. That's the bottom line. So the teeth, we're used to looking teeth out, but we need to kind of look out, and then teeth are kind of the last factor when it comes to this. If they shift a little bit, you'll probably be fine. If you're not breathing, you're not fine. And that's just what,
That's the truth.
That's the truth, so you'll be fine. And there are ways to fix it if it becomes bothersome. It's usually not bothersome, but there are ways to manage everything. But the most important thing is phase 1.
Yes. Thank you guys so much.
Thank you for the questions.
Thank you for the questions. They were really great questions. If you watch this later and you have a question, please leave it in the comments below. Share, like this video so that we can get everyone tested. Yes. Thank you guys. Enjoy your weekend. Bye.